Hello, I'm Dr. Dawn Harper. Welcome back to the Stay Sure Wellbeing YouTube channel, where today I'm going to be talking about vaccines, and in particular the flu vaccine and the potential coronavirus vaccine, which is much talked about in the press. So we are heading into flu season, and I think this year more than ever it's really important that anyone who is offered an NHS flu vaccine really should take that invitation. So the people who would normally be offered the flu vaccine are children, anyone over 65, those with long-term health conditions, and health and social care workers. This year, the government are also hoping to offer the vaccine to those between the ages of 50 and 64. Now, we are being told in general practice that it's important that we vaccinate the at-risk groups first, and so those healthy people between 50 and 64 will probably be offered the vaccine a little bit later. But if you're offered one, please do take it up. We know that the NHS is always under pressure in the winter, and the combination of flu and coronavirus really could tip the system over the edge. So let's all do our own bit to try to protect the NHS. I've already had my vaccine this season. And the coronavirus vaccine, well, how close are we? We hear various different reports that it may be here in just a small number of months. The important thing is that we ensure that we have a safe and effective vaccine. When that is the case, the government, I know, are working very hard to roll out a programme and to make sure that we have enough vaccine available to offer to all those people in the country across the UK that would want it. How that will look is difficult to know at this stage, but there is talk about involving perhaps the military to help to administer all those vaccines, because of course it will be a huge programme to vaccinate the whole country. So we don't know as yet, but we will be hearing more and more. And as soon as we get that vaccine, I know that there will be all systems go to get people vaccinated as quickly as possible and start to emerge from this hideous pandemic. The good news, we are in the second wave, and that's awful, but the good news is that medics are much more knowledgeable about how to manage this virus. So when coronavirus first hit the UK, we were on a very steep learning curve. We didn't expect to see so many people with problems with blood clots and the like, and sticky blood. We didn't expect all the kidney complications, and we were learning quickly about how best to ventilate patients with coronavirus. We now have a lot more information, and we are ahead of the game on that. So although the numbers may look scary, thankfully fewer people seem to be dying at this stage of coronavirus, and we will continue to work hard to look after as many people as we possibly can. But one thing that has come to light is something called long COVID, and it's an interesting complication. So previously healthy people, often who you would expect to be able to just fight off the virus, talk about having weeks, sometimes months of what they describe as brain fog, fatigue, inability to concentrate, ongoing shortness of breath, or a persistent cough after the infection has cleared. And that's something that we are again learning about and learning how to manage. I think it's really a tacit reminder to all of us that it may be tempting to think that if you are otherwise fit and well, that you'd get away with a minor illness. And of course, statistically, you'd be more likely to have a minor illness or possibly no symptoms at all. But it is a little bit of a game of roulette, really, and I've met a lot of previously healthy, fit people who I would have expected to recover very quickly, who have gone on to have these long COVID symptoms. There's a professor actually in the UK who has said he's not been able to get back to work. His brain just is not functioning. He can't concentrate, and he doesn't have the mental agility that he needs to practice safely. So it's really important that we all do our bit. The rules, I know, are changing all the time. Please do abide by them. If you're planning to travel, as always, check what the rules are regarding coronavirus in your destination. You may be required to have documented evidence of a negative test within a very short period of time of travelling before you're allowed entry. And I know that just recently we've heard headlines of tests being offered at 2 terminals in Heathrow, so that you could actually arrive at your destination with confirmation of a negative test, although you may have to pay for that pleasure. And they're talking about fees of around £80 to get those tests done at the airport. I hope that helps. I hope if you are going away, you have a lovely holiday. But until next time, stay safe, stay well, and do let me know if there's anything that you want me to talk about on this channel. You can either message me here or you can email us anonymously and tell us what you'd like us to talk about. But until then, stay safe. Goodbye.